Welcome to the Longevity Protocol with Dr. Cristina Bosch and Dr. John A. Robinson. We'll be your guides to uncovering the secrets to optimal health, better sex, and happiness. From debunking aging myths to exploring the science behind what it means to live the Longevity Protocol, we'll dive into a wide range of topics. So, get ready for an exhilarating journey in what it means to live well and feel your very best at any age.
Menopause.
Yes, menopause. This is it's a hot topic for us because we talk about it all the time.
It's a hot topic.
And it's literally,
Get it?
it's a hot, flashy kind of topic. Yes, a sweaty kind of topic.
Yuck.
And all kinds of things.
Yeah.
And we're going to talk about that today. We're going to
Okay.
talk about menopause. And this is a two-part episode. I'm excited about this because we said, let's kind of really get into it and talk about all things menopause. So this, if you're wanting to understand more about menopause, this is the episode. And it's two parts. We're going to get into the menopausal matrix, as we call it, that the whole kind of concept behind what is menopause, how do we diagnose it, what does it mean, what are some of the technical things behind what estrogen does and testosterone in a woman's body. And then the second part, we're going to actually talk about menopausal advocacy and dispelling those myths in and around that, and what that actually means, because there's actually now advocacy out there for menopause. Things have changed. I mean, a lot of things have changed.
Yeah. I want to say, just because as we talk about advocacy, often the biggest advocate in a woman's life should be her partner, like her husband.
Well,
So when we're delving into the ideas of menopause, this is not a woman-only episode. It's really great for men to listen to this so that they can have a better understanding into their female's process, because it's not it's often not an easy thing to go through.
It isn't. And part of the reason I think it is difficult for women, aside from all of this, the general symptomatic hell that they can go through, they have people around them that are not understanding.
Right.
Their spouse, it could be even their kids.
Or themselves. They just don't know.
Or their doctor that definitely doesn't understand.
Right.
How many times we've heard, these a woman right around 50 going in and talking to some young doctors around 30 odd, and she's sort of half rolling her eyes and just saying, you got to live with it.
Right.
And we've seen actually patients come and say, and they stay with their gynecologist, and that same gynecologist, after a certain number of years, then comes back and said, can you tell me the name of that doctor you're going to? Because now I'm starting to have a hot flash. I know what you're finally saying.
Yeah.
Where prior they were saying, don't worry about it. Don't do hormones. It's going to cause breast cancer and all that other kind of nonsense. So yes, this is a two-part episode. This first part here, let's get into the what is menopause, what are some of the symptoms, how and what it is that we do to be able to help women with that. Let's start on that now.
Okay.
I mean, what do we say when we're saying menopause? How do we define that?
I mean, we've talked about this before, but it's important to remember that this is really a period of time. So you're either basically pre-menopause or post-menopause. Menopause can be a pretty lengthy amount of time in which a female is having irregular periods or no period, and then the period can come back. Being postmenopausal is defined as having gone 12 consecutive months without a menstrual cycle. If you go 11 months and 3 weeks and 6 days and then you start bleeding, you're not done.
Yeah, you're perimenopausal.
Yeah,
you're not there fully into it yet. Yeah, it's and with menopause, it is I always say it's a permanent state or condition of being. Once you're there, you're there. So that's, sometimes that term of even postmenopausal gets kind of confusing. There's this line between not being there and being there, but then menopausal versus postmenopausal tends to make it sound like there's two different things.
John, I think it is two different things if the female is doing HRT. I really do.
That's a good way to put it.
Because I think if you're doing hormone replacement therapy,
now you're just menopausal.
Then you're just postmenopause.
Oh, I see.
Because
I see what you're saying.
You no longer have a period.
I see.
But you are still you no longer have a period. And you feel well, you just no longer have a period.
Yeah. And and you're feeling well because you're on hormones.
Yep.
Yeah, you could be postmenopausal and just not feeling well.
So I understand what you're saying about how it's this like eternal stage, but it's only an eternal stage if there's symptoms associated. Otherwise, you're either bleeding or not bleeding from a menstrual cycle.
Yeah, well, we can define menopause also as just sort of all of the things that go along with it, the increased disease risk, cardiovascular disease, diabetes, osteoporosis, Alzheimer's disease.
And then weird things like fat
Deposition, right?
fat
right.
in places that don't seem to make any sense. Like the top of your back here.
Yeah.
Why?
The armpits.
That really pisses me off. I gotta tell you. I mean, I had babies late and I got huge with all of them. And thankfully I've worked hard to get my body quote back. But screw those things. Those like, what's this armpit situation?
I don't know what that's about.
Things that women have told me over the years that I'm like, okay. I mean, not that I rolled my eyes at them. No, I've always been wise enough to validate their concerns, but you can't understand until you experience something like an armpit getting fatter. So a
menopausal symptom number one,
fatty armpit
fat. Yeah, right, yeah. Okay, but yes, there's many things: the hot flashes, the night sweats, the sleeping difficulties, all kinds of mood disorders. Yeah,
God.
Sleep. Yeah, that is often disturbed just simply because you're having a night sweat at night.
True.
And that's part of the disturbance. But the ability to get into REM and to stay in REM is often affected by the lack of the hormone. Okay, so how do we diagnose it? Many of these things we're saying here, we're just talking about symptoms. What's going on? Libido, and that was, of course, anxiety, depression, mood swings, irritability, all those things that go on with it. And we distinctly measure their armpit fat and we check that out, make sure what's going on with that. And that helps us to understand. But that's also, we're diagnosing it based on labs.
Yeah.
Based on labs. What's going on with their estrogen, their testosterone, and we check something called follicle stimulating hormone that winds up being really, really important to understand where they're at in that menstrual cycle process. What's going on with the FSH? If your doctor is not checking FSH when it comes to determining what's happening with your menopausal situation, they do not know what they're doing.
Yeah, I mean, I would say personally, and let's just take the idea of birth control out of the conversation. Let's just start with the premise that there's no birth control involved, okay, right? Because that could misrepresent levels. I would say that the symptoms and then the FSH are going to be the primary way that I'm diagnosing and really understanding what the treatment approach should be to help guide my females through their menopausal journey.
Yes. Okay. Everything seems to have a sort of a spiritual take.
Hopefully.
And certainly when it comes to menopause, I think that there is that relationship there with that. When women are starting to go through that, they're having the mental and emotional issues too, but it inevitably kind of bridges into what does this time in my life now mean to me spiritually? Do I have a spiritual path or not? It helps you to perhaps even recognize that, but just in and of itself, menopause has a spiritual sort of definition to it. It is very much about personal growth, whether or not you've had personal growth. That's the big thing. Growing, but did you figure it out?
Let me interrupt you for a second. This whole section that is at the top of our notes, because that's how important it is probably the most poorly understood and underrepresented part of the aging female. So I really I want to take a moment to pause before you keep delving into it to say, women, listen up, and men, because this is the piece that they are not receiving. They're not being told. And this is what helps us women feel so much better about this idea of getting older. So go ahead.
Well, to that, it is a transition into a deeper understanding about yourself and your position then as a woman. It's a maturity. I mean, this happens with men, but in a different way. Women have this passage and rites of passage. It happens at menstruation as a young girl moving into womanhood. And then it's also represented by this other sort of physical change. Women go through these kinds of things and they're rites of passage that mean something and can mean even more if they understand it more. So yes, personal growth, it very much about releasing the past. I think that you can't move on, I think, until you've released the past. And all of that gets brought up at this moment of menopause. So it's about wisdom. It's about wisdom.
Wisdom, that's the word. I mean, release the past. I think the idea of releasing the past is that you're untying yourself from blame,
Yep.
excuses, regrets.
Mm-hmm.
We bring our past with us wherever we go, in the sense that it's what's shaped us. But how it shapes you depends on your relationship to the past. So if you bring the past with you because you've learned things, that's where that wisdom comes from. Because you've seen, you've experienced, you've absorbed, you've evolved, then you're taking the past with you. When you say release the past, I think what you mean is that you're letting go of.
You're forgiving.
You're forgiving.
You're forgiving. And the
self and others.
Yes. And that's what I wanted to say. That it is, you got to forgive all the other ones, all the trespasses against you,
right?
But also your own trespasses and what you've done.
Yep.
And if you can continue to really forgive that at this pivotal moment, then you can evolve into this next transition. I think that's where many women and men can get stuck at this transition that tends to happen right at around 50.
Right.
There has to be levels of forgiveness that goes on so you can have your past and take it with you, but it's in a way that's comfortable because you've forgiven.
Right. So that wisdom, the idea of the crone nowadays gets pictured or depicted as some ugly old witch who's poisoning poor Snow White. But that's not really what the crone was. The crone really was symbolic of the wise woman of the community, the one who had experienced enough cycles around the sun, or she had seen enough to offer her experiences to either prevent or heal or just enhance, right? So when we're talking about menopause, we're seeing in modern day society that people end up saying, oh, I'm having these midlife crises. I don't actually know who I am at this stage.
Yeah.
When it's the opposite. What we should be doing is saying, what have I experienced and who then do I choose to be moving forward?
It's what a great opportunity.
Yeah.
Then. And what makes all of that easier, so now let's kind of get into some of the nuances of how we treat it, because we do kind of see this as a situation that needs a level of support to be able to help them move on with. I've said this for years, that medicine is anything that helps you to understand more about yourself.
Mm-hmm.
If that agent doesn't help you to understand more about yourself, it's not really medicine. So you can use many things to help you understand more about yourself, and then it becomes medicine. And I would say, even as I've gotten older, I would enhance that definition to say that medicine is anything to not only help you understand more about yourself, but how yourself relates back to God. And that's how I would kind of enhance that, because I wouldn't want to make it completely, selfish, self-centered only to that. But it's not egocentric. It's not egocentric. It still should be a connection to a higher power, but ultimately know thyself. That's what it's about. So what are some of those things that we can use now? We're going to get out of the esoteric and just kind of talk about the practical. I mean, women need estrogen. When it starts to go down, and estrogen has been historically so vilified for literally a generation, since 2002. It has been fantastic for us to be able to stand up very proudly and say that finally they have done away with the nonsense of the Women's Health Initiative and the massive errors that they had made in saying that there was an association with breast cancer and estrogen. It was completely wrong. And we've now come full circle, thank God, and understand that it wasn't doing that. So it should allow anyone listening, if they have any level of hesitancy about estrogen, as they thought it might be because somebody told them it was related to a breast cancer risk, it is very clear that it just isn't, and it isn't anything to worry about in terms of risk. We always need to weigh out risks in general in medicine, but ultimately that risk is incredibly small to basically none. Right. It's not what it was certainly told that it was, and that women should feel confident about that.
Right. So I think the biggest issue is that because that information has been rightfully debunked, everyone should start with the yes. Yes, I would like to explore estrogen replacement. Now, whether the nuances of your picture prove to be that you're a candidate or not a candidate, with most people proving, yes, I am a candidate. The difference is that now people should approach it with a yes. Whereas I think prior to the very recent past with the exposés, it always started with a no. It was like, no, I won't use estrogen. Oh, but I'm doing so horribly. I feel terrible. I have osteoporosis. It was only until there was an accumulation of so much craptastic, unnecessary aging as a result to the massive decline. Yes, estrogen is supposed to go down as we get older, but it's not supposed to go away.
Yeah, that's a great point. So many patients, they suffer.
They suffer
unnecessarily. And then when they finally come to us, and we're glad that they did, obviously, but, and they'll even say to us, God, I should have done this years ago. How many times we hear that?
And the problem is there's so many conditions that become more difficult to reverse that could have perhaps been preventive estrogen replacement therapy had been used in the first place.
Yeah, a great example of that would be heart disease. And plenty of research to sort of support that idea now, that early on prevention or intervention with estrogen therapy, et cetera, is going to help with those kinds of things. And it's harder to reap those cardiovascular benefits
once the damage is done.
Yeah, and you've waited. You still can do it, but the benefit is harder to reap those benefits. So yes, early intervention, but everyone, ladies, it's not too late.
Yep.
So talk about testosterone, DHEA. These are not male hormones. These are human hormones. Women need testosterone for virtually the same exact reasons as men do. Men just need more of it. DHEA is another really good one. When it comes to some of the symptoms and issues with menopause, vaginal dryness is, without sounding too dramatic, vaginal dryness can be a life-threatening issue. And the reason it is because it can lead into frequent urinary tract infections, UTIs, of which can, in rare cases, become very complicated and go into sepsis. And yes, there are deaths related to complicated UTI. And a lot of that was because there was vaginal dryness that could have been handled incredibly simply by estrogen and or testosterone and or DHEA. We have found if there is vaginal dryness and pain with intercourse and those kind of things, DHEA cream locally it can be magic for women. And we've had patients that we've talked about on podcasts regarding that. So it's know that is there for you too. But testosterone, that's helping with libido.
And bone and muscle.
Yes.
Yeah. Okay.
Metabolism, decreasing fat, helping insulin to work better. Testosterone's helping with a lot of mental, emotional things.
So big.
It helps with stress resilience. It's massive. So, and estrogen's doing many of those things too that we were just saying. But they each have their own benefits, and that for us, we just put it all together.
It's
so
comprehensive.
Estrogen, progesterone, testosterone, DHEA, and other hormones, all of that should be considered for the menopausal woman. Yeah. This sort of mental and emotional issue is also, I always say to patients, you don't have a Prozac deficiency. There's no such thing. But there is such thing as a hormonal deficiency like estrogen or testosterone. And it is those hormones that will help with serotonin and epinephrine and norepinephrine and dopamine, all those neurochemicals that sometimes we're using these other agents for that may be necessary, but many times it doesn't have to be, because often patients will come in on those types of medications. We said in another podcast that often they're being given by primary care physicians and all that sort of haphazardly. They use it off label for hot flashes and night sweats. And it's not the right agent most of the time. What they needed was the hormone replacement therapy to help. And that's going to be the more accurate agent for them.
One of the good ways I think to tell is if you're using one of these medications because you're having low-grade anxiety and sleep disturbance. Okay, but you're also having vaginal dryness. You're also having a loss of fat in the cheeks and in the breast, but you're having extra fat in the abdomen where you never had it before.
Yep.
You're also weaker. You're also losing your libido for sex and intimacy and connection. And so if you have all of these symptoms, then it's probably not that you're just suffering from anxiety. It's probably that you're having a systemic deficiency in hormones that is resulting in this complex presentation.
Yeah, that's a great point. And that's that chicken or egg thing. That once you have these direct physical issues, that's obviously not making you feel good about yourself. And then again, vice versa. It's a nasty spiral. Yeah. So you've got to stop that crazy train, and you can. One thing that we said that we wanted to focus on here was gastrointestinal issues in menopause. And we wanted to focus on that because it's not often known. So yes, you have issues with the gut when you have a lack of estrogen. That is really, really important for people to understand, that because it's a very common, just having bloating, that's probably one of the most common things you hear as it relates to women and hormones and periods and all that concept of bloating. But even bloating that's occurring in menopause, and there isn't hardly any estrogen around, and they're actually having worse times with digestion.
Yeah. And this is a really big deal because the gut is the second brain. We say that. So if you have an unhealthy gut, then you tend to have unhealthy brain. But the other thing is, we spend so much time talking about the root cause of illnesses. And if you are not having appropriate digestive function because your hormones are low, then you are opening the door for a rapid decline for any number of illnesses that are related, chronic inflammatory illnesses that are related to age. Mm-hmm. So we're having people that are suffering from all these other things like the osteoporosis, for example. And it really comes back to the fact that they're not absorbing their nutrients well, and they're not absorbing their nutrients well because their hormones are unnecessarily low.
Yes. There's estrogen receptors up and down inside the gut. And people often don't think about it that way. I mean, estrogen, sex hormones like estrogen and testosterone, we're thinking about, it's affecting sexual organs and those types of things. We don't think about the fact that maybe it's affecting our brain and our muscles. Maybe we think of bones with estrogen. That might be one of the ones you think about, but ultimately it is affecting your gut. There's receptors for that. So estrogen is a smooth muscle relaxer. It's helping to increase motility or movement of food and all that moving through the gut. It's helping to repair those epithelial cells. So this is just part of the whole gut repair concept that we do all the time. We're helping patients with their gut.
I love working with the gut.
Absolutely. This leaky gut concept that people are worried about is prevalent in the perimenopausal and menopausal women. And in part because their estrogen is there to actually help with those things. So they need healthy estrogen. Interestingly, part of the breakdown of the lining of the gut is made worse by synthetic estrogen, like the birth control pill. So you have the negatives of the birth control pill affecting the gut, but yet estrogen there's receptors there because it's looking for natural estrogen, which is what, of course, we promote and use. So there's a big difference there. Know that. It's regulating the gut microbiota. I mean, this gut microbiome that everybody's talking about now, again, we've been talking about for decades, but it's really cool to see this discussion and move towards understanding that, because like you said, the second brain, we've been saying that for years. And a lot of that has to do with the good bacteria, the gut microbiome that's there. We need to have that influenced positively through diet, but ultimately we're getting that with estrogen too.
Right. That's right. Mm-hmm.
So yeah, it's anti-inflammatory. It's helping with neurotransmitter effect. So estrogen is helping with those neurotransmitters in the gut. That's the other thing. So people think about neurotransmitters in the brain, and it's true. They're influencing the brain and to some degree being produced in the brain, but the massive majority of neurotransmitters are actually produced in the gut that then in turn influence the brain. So we need a healthy gut. We need healthy gut microbiota, the microbiome. All of that's influenced by estrogen. So wanted to make sure everyone understood that. And then the other kind of things we talked about, bone issues. Quick shout out to the Osteo Collective, Dr. Doug Lucas, who's really a fantastic doctor, orthopedic surgeon,
Incredible advocate for women's health.
and particularly and specifically osteoporosis,
Yeah.
because there's no one out there really doing that. And that's, we really
I have
learned that
learned
from him.
so much.
Mm-hmm.
And you can follow him on social media for sure, Dr. Doug Lucas. We've learned so much by just connecting with him, speaking with him. But I myself follow him and just get pearls on a daily from the things he posts. So super cool guy.
Yeah, and you're right. A big advocate for women's health. They have online consultations and all of that.
Yep.
Now, what he tends to focus on in this, where we can talk about this, because now this will lead into how do we treat hormones, estrogen deficiencies, testosterone deficiencies for women. Dr. Lucas and his group, they tend to focus on creams. Again, they're doing a lot of things from a telemedicine standpoint, but he was a very open-minded guy.
Yeah.
Because we were on his podcast, I don't know, about a month ago or so. And he even said at the end, because I said, I want to come on and I really want to talk about pellets.
Yeah.
Because he wasn't a big pellet guy. And he's been learning all of this stuff, I say relatively recently, maybe the past 5 years or so. And he's been working with a lot of other very brilliant doctors and providers that are using creams. So he kind of went into that direction just based on who he was being influenced by. And when it comes to hormone pellets, which we believe is one of the best ways to go about it, there's people out there that just are flat out, like almost against it.
But I think that's how you know that you're working with someone who's really interested in the benefit of the patient, because they are constantly challenging their own biases.
Yes.
That's I think that is definitely paramount to being a physician. Like, I am always trying to say, let me listen to the people that I think I completely disagree with, because I want to always challenge my perspective. And estrogen is one of those great places. Like, what are people saying out there about estrogen? Let's hear it. Let's learn it. And if I can still come back to my answer, which is definitely replace the estrogen, preferably use things like pellets or injections, then I'm doing it with confidence that I'm really thinking about the patient's well-being as the most important decision maker.
People don't think. I was listening to Dr. Jordan Peterson. What he means by that is that the process of thinking through and challenging yourself in your own, people just sort of absorb things and take it in, but they're not actually stopping and really thinking it through. And the reason is, as he was saying, was because it literally does that. You have to challenge your own bias in order to think. You have to almost internally create an argument with yourself and go through that to think.
You know, it's funny that you say that. My sister, I will often say to her, what are you doing today? And she'll say things like, I have a lot of things to do, so I'm going to go home and think. And I always kind of make fun of her because I'm like, you're going to go home and think. But she's totally right.
Yeah.
You need to just sit in silence with your own thoughts. And if you have a lot of decisions to make, you need to give yourself the space to make those decisions so that you're not just choosing the easiest answer or the fear-based answer or the biased answer or the biased answer. To make the best decisions, you actually have to just sit down and think. Estrogen helps you do that.
Yes. And so do pellets, because pellets are the only way to do hormone replacement therapy. Any other way is insanity.
No, he's definitely, I hope that never gets taken as a tidbit. He's definitely saying that totally
real on
facetiously
that one. No.
Because we don't use estrogen only in the form of a pellet.
Correct, we don't. And so, yes, there's many sort of roads to improvement in heaven there. So with that said, when you know how to, I believe that in general, hormone pellets are at the top of the list of consideration when you know how to wield that tool. And we've been doing it now for 18 years. There's not many people in the country that have been doing pellets as long as we've been doing pellets. And we really know how to do it. Yeah. So as there's been more and more people kind of coming on the bandwagon of hormone pellets, you get a lot of monkey business out there.
True. But aside from really perfecting dosing with pellets, what we've also seen are all the other things that people do, like the monkey business with pellets, but we've also seen the creams, we've seen the patches, we've seen the injections, we've seen just herbs, like we've seen a lot of things. And what we keep coming back to are pellets predominantly.
And with that said, the other route that we will use is injections. But where we've come we had to go through a discerning
Yep.
process of injections because
And a challenging of our biases.
very much so, and sort of experimentation on how to do it correctly for the sake of the patient. When it came to injections, historically, they were, now looking back, they were horrible the way they were being done.
Yeah.
But we realized that, the baby was getting thrown out with the bathwater on injections because they were just giving large amounts once a month. They were getting these huge spikes up and big drops down. It was just dumb the way they were doing it. So we just said, well, wait a second, what if we just gave smaller amounts more frequently?
We stopped and we thought.
Yeah, we stopped and we thought and we challenged and dared. I think that's a big part of thinking as well. You got to sort of be daring. It's definitely a big part of medicine. A lot of times doctors get complacent and they're not willing to just let's take a quote unquote calculated risk for moving forward and seeing how this will help the patient when it's done in a controlled way and in a thoughtful way.
And you've said this before, but we're just very lucky to have patients that are willing to play with us these games. And the reason is, and this is important because this is how I want all of you to behave. The reason our patients are willing to experiment with us is because we engage them in so much discussion. We remind them that we are there as a guide. Ultimately, the responsibility and the decisions about your health lie on you. But to make those decisions, you have to do your research, challenge your biases, think, and find a practitioner like us that is really dedicated on one thing, which is helping you feel the very best you can.
Yeah, absolutely. Having an advocate for you as you're advocating for yourself, and they're advocating for you to advocate for yourself.
Yep.
Empowering you.
And if you are perimenopausal and you are finding yourself on this chapter of your life and you have a doctor who's excited about your menopause, I think you're already not partnered up correctly. You really need to find that person that says, okay, this is great. This is an amazing opportunity. This is a very exciting, a very fulfilling chapter of the female's life. However, we're not supposed to suffer through this book.
Not into suffering. We definitely help people to get through all of those things. We're all kind of on this process here. We just want to make the ride better. And that's definitely what hormone replacement therapy will do for the menopausal woman. Or the perimenopausal woman. So definitely get your levels checked, find someone that's going to be that advocate, be an advocate for yourself, do your research like you said.
Our book is a great guide for those people who don't have access to us.
Yes.
And everyone can check us out. They can reach out to us directly for our advice and opinions.
Look forward to seeing you. Are you liking what you're hearing? Do you want to hear more?
Are you loving this great content and do you want to ask us a question?
Please like, subscribe, and comment.
You can find all of our links on our social media, featured articles, basically everything we cover at Linktree at Longevity Protocol Pod.
And if you want to understand and hear a little bit more about our personal lives, follow us on Instagram at The Sex Docs.
Here's where you can comment and ask questions that we will directly answer in our videos.
Be sure to subscribe to our Substack. This is where we get far more information for you, protocols on longevity and health, and definitely the notes for today's episode.
And finally, if you're ready to make a change, a real change in your own life, feel free to check us out at our private practice at hormone-zone.com.